that it's recording now. Cool. Awesome. And so welcome to the second student author Ask Me Anything series. We're going to hear from Ling Li and Yu Song from the University of Wyoming about some of their recent work on ACL injuries and recovery and rehab from them. So with that, Aaron Helm is here also from the student committee to help us host because he knows more about ACL stuff as well. And so we're going to kick it off with Ling Li. She's going to get us started. Take it away.
Can you see now?
Yes, we can.
All right, perfect. I just muted myself. All right, so I can stay. All right, I'm Ling Li from University of Wyoming. I'm a first year PhD student. So first, thank you so much for the opportunity that we can present our study here. This is a study, this study that I will present today is my first study that I was involved in the ACL. So the most ideas came from my advisor, Dr. Dai. Thanks for him to bring me in this cuckoo study so that I have a chance to share it with you today. All right, let's get started. So first, the topic is about the ACL, the anterior cruciate ligament, and the ACL injury prevention. So let's talk about the ACL first. So ACL is a rope-like structure running from the femur to the tibia. It primarily restrains the tibia from sliding excessively forward. Epidemiology studies show that the most ACL injuries are often occur when athletes land primarily on a single leg. Here is an example that Jamal Murray turned his ACL last year, keeping an eye on his left side because that was what was injured. So we can see here. All right, so we can see Jamal was landed on a single leg. He put all his weight on left side and his knee is almost straight. The similar case happened on the Klay Thompson in the 2019 NBA Finals. Klay landed on a single leg with a small knee flexion angle after a dunk. Previous studies have been showing that landing with great peak vertical and posterior forces at the small knee flexion angle may increase the ACL loading. So developing the effective landing strategies that target the knee mechanisms has implications for ACL injury prevention. One technique to modify the knee loading during landing is to land softly. The soft landing was considered as increase the knee and hip flexion throughout the landing. The soft landing has been suggested as a strategy to reduce the risk of ACL injury. However, the most studies focus on the effectiveness of the double leg landing. It's unknown the effectiveness of the soft landing styles in single leg landings. Rolling is another landing technique. It's a very important skill in parkour. The rolling is characterized by the initial land softly and then smoothly forward and roll toward the hands and shoulders. One study involving the parkour in our lab that the rolling landing could decrease the downward and forward velocities over a longer time, which was likely to decrease the peak loading on the lower extremities. So evaluating the effect of the falling on the ACL loading variables is also important for considering the falling as an ACL injury prevention strategy. So the purpose was to compare the ACL loading variables such as knee flexion angles, impact forces, and knee extension moments among the natural landings, soft landings, and falling in forward and vertical landings under the single leg and double leg conditions. 16 males and 16 females participated in this study. For the forward jump landing task, participants need to jump forward from the 30 centimeter high box, place the half of participants' body height from the first plate. For the natural landing, participants just landed as they would in a sport setting. The vertical landing task defined as jumping vertically and touching a basketball that is set at 75% of the participant's maximum vertical jump height. Here, the main results from the study. The independent variables are here, the 3 different landing techniques in the vertical or in the forward and the vertical landing under the double leg and the single leg conditions. So dependent variables are the knee flexion angles, the peak vertical posterior ground reaction force, and the peak knee extension moments. And here we use A, B, and C to indicate the significant difference, which is A is greater than B is greater than C. So look at the leg conditions first. So single leg landings resulted in decreased the knee flexion angles and increased the peak vertical and posterior ground reaction forces and increased the peak knee extension moments compared to the double leg landings for both forward and vertical landing tasks. Look at the landing techniques. Falling had the greatest knee flexion angles and soft landings were the second greater. For the impact forces and knee extension moments, falling was generally the least and the second least for the soft landings. However, under the single leg soft landing conditions, some of them didn't have significant difference compared to the natural landings. And when look at the effect size, mostly in the single leg landing conditions showed the small to medium effect size between the soft landings and the natural landings. But when we look at the landing techniques, small and medium effect size will show between the soft landing and the natural landing, but the medium to large effect size between the falling and natural landings. Based on the results, we can find that the soft landing could result in a decreased knee loading compared to the natural landings. It's because the soft landing allows individuals to decelerate the initial landing velocities over a longer time to decrease the peak impact forces. But the effectiveness of the soft landing in reducing knee loading was limited for the single leg landings compared to the double leg landings. The decreased change could be related to the lower extremity strength because softer single leg task required greater strength to perform a single leg standing posture. Falling showed the increased knee flexion angles and decreased impact force and the peak knee extension moments compared to the both soft and natural landings. It could be because of 3 reasons. First, the falling allows participants to continue moving forward. They don't need to stop at the end, so less posterior ground reaction force is needed for resist the forward velocity, so result in decrease the posterior ground reaction force. In addition, for the vertical velocities, it would be absorbed through the greater range of motion, so lead to decrease the vertical ground reaction force. And meanwhile, the upper extremities and the trunk can decelerate the whole body. The current findings implications for jump landing training for ACL injury prevention were, first, preparation for the single leg landing is necessary for reducing the ACL injury risk. Single leg landings result in the great impact force and knee loading compared to the double leg landings. So it's important to prepare it, right? And the second, limitations of the soft landing techniques should be noticed. The effectiveness of single leg landings could be further reduced due to additional demands for the lower extremity strength. Third, the falling could be a potential strategy to decrease ACL loading during landings. Why we call it potential? Because it has the limitations as well. For example, it may spend a longer time for players to stand up than continue the play, but the games have the time strained, so it may be not good for the following the sport's performance. But if the falling is performed at the end of the play, like the video show here, it may be a good strategy to decrease knee loading when the athletes land on a single leg. So in summary, to develop the progressive training of effective and safe falling techniques can be considered as an ACL injury prevention. All right, so I think that is the most important part of this study, and thank you for listening. Thank you.
Thanks so much. Great job. We're going to roll right through to you, Song, and then we'll do questions on both and between and about it and how you did it at the end.
All right. So, yep. Thanks for having us. And hi, everybody. I'm Yu, and before I start the study, I'd love to introduce what we are doing here and also introduce me. So first of all, thanks again. Thank you so much for inviting both of us for this activity. I do think as a graduate student, it's good to find a community and build a great environment to communicate with each others. It's always good to meet somebody with similar interests and I mean, for the coming conferences, hopefully we'll see you guys in person. So I started my program in January 2020. I had my master degree and the bachelor back to China, where I come from. And this program, now I'm funded by the exoskeleton study. This is another project that we worked on in our lab. We got a paper published last year, mainly is about the trunk exoskeleton. People did several lifting tasks, and we're trying to measure some abs, EMG muscles on abs and low backs. That's another study we interested in our lab. And they're gonna has another one coming this summer. It's still about the exoskeleton. And besides about that, and I'm working on my research dissertation now, it's about the trunk perturbation during the jump landing and the cutting. We're trying to simulate some maneuvers during the real sports and connect with the study I'm going to share today. We have other two studies under review about the post ACL injury. It's more about the differences between tasks and also jump landing and as well as squat. So that's a big background about my our lab, what's going on, and yeah, I'd love to share with you guys all. So for today's study, I hope I have a short title here, but sorry. So it's about medial-lateral hip positions predicted kinetic asymmetries during double leg squats in collegiate athletes following ACL reconstruction. So I think ACL injury is quite a popular topic in sports biomechanics because the epidemiology study already showed that. So for this study, we more focus on NCAA athletes because it has been shown is one of the most frequent severe injury in NCAA athletes. So after the ACL injury, ACL reconstruction and post-surgery rehab have been commonly performed to help them to prevent secondary injury and back to the pre-injury sports level. So in this case, double leg squats has been commonly used in the early phase to strengthen lower limbs, and also it has been shown could be used as a screening task to monitor the bilateral asymmetry strategies. So what happened here? In fact, bilateral asymmetries in vertical ground reaction force and knee extension movement have been commonly observed, with a greater value showed in the uninjured leg. But these asymmetries in knee extension movement is a risk factor for high ACL re-injury risk. That's why we care about it. As you guys probably know, to monitor such knee movement asymmetries, we have to use force platforms, synchronized motion data, and sophisticated calculations, which means the practical applications has been restricted. So that's where we come from. So previous efforts has been made to predict such knee extension movement asymmetries. It has been shown that vertical ground reaction force, bilateral vertical ground reaction force ratio, and the position of center of pressure could predict such knee movement asymmetries. However, all those variables required the use of force platforms. So let's keep it simple. So can we use a camera to monitor some kinematics movement pattern to predict it or monitor such kinetic asymmetries? That's a question we raised up. Based on this, the purpose of this study the primary purpose was to find the relationship between the kinematics variable, which were medial lateral shoulder hip positions and the lateral trunk bending angles, and the kinetic variables, which were risk factor, knee extension moment asymmetries, and the vertical ground reaction force asymmetry. The secondary purpose of this study was to monitor the kinematics and kinetic variables changing at 2 assessments, which were the first 6 months after ACLR and the second 6 months. We hypothesized that both variables gonna be strongly correlated with each other. Besides, the kinetic asymmetry is gonna decrease and the trunk movement gonna be more neutral. So overall, there were 17 participants. 12 of them participated 2 assessments, and the information has been showed here about the sample size at the 2 assessments. So we placed the 24 markers on the participants. We used the first platforms and cameras. Each of participants performed 3 double leg squats. So all those variables were extracted at the lowest hip squat position, and the responses, which were kinetic variables, a vertical ground reaction force, and knee extension moment asymmetries. The asymmetry index has been calculated based on the uninjured leg minus injured leg divided by larger value among each leg, which means a greater value showed in the uninjured leg gonna give us a positive number. So for the predictors, the kinematics variables, we measured the medial lateral shoulder and hip positions. If we look at the figure here, the blue dot and the green dot are the middle point of bilateral shoulders and hips. The distance relative to the bilateral ankle center here, those are the medial lateral shoulder and hip positions. We also calculated the shoulder and hip bilateral bending angles. We defined that angles as the shoulder and hip vectors relative to the horizontal line. If you bend it to the uninjured leg, it's gonna give us a positive number as well. So Pearson correlation and simple linear regression analysis has been performed. We also performed the independent t-test between the 2 assessments to verify the secondary purpose of this study. So these are the results. So first of all, we did not find any significant differences between the shoulder and hip lateral bending angle and the vertical ground reaction force and the knee extension moment asymmetries. So why that happened? We think the lateral trunk bending is pretty easily self-perceived and self-observed, which means during the training, you could easily self-correct yourself. Based on a mirror, or maybe verbally instructed to avoid this movement, such as maintain a straight trunk. That's why we think we did not find significant difference correlations. However, we found the shoulder position significantly strongly correlated with vertical ground reaction force asymmetry at 2 assessments, while the hip position significantly strong correlated with both vertical ground reaction force and knee extension moment asymmetries at 2 assessments. So before we talk about why hip found the most significant differences, we want to talk about the nature of the squat. It's a relatively slow and balanced functional task. That means patients could self-select their movement pattern to unload their injured leg, which means they could move their whole body to the uninjured leg. Because in this slow and balanced movement, we think the center of mass closely located to the side with greater vertical ground reaction force. Keep this in mind. The hip region composed nearly 60% of the whole body mass. So hip shifting could be a more effective strategy compared to shoulder shifting during squat. That's why most patients, they choose to moving their hip as a strategy to unload their injured leg. To look at the figure further, we could see the second row is the relationship between the hip position and the knee movement asymmetries. there are two positive intercepts shows here. So what that means? That means a neutral hip position could reflect balanced vertical ground reaction force, but not balanced knee extension moments. So why that happened? Mechanically speaking, knee extension moments could be modified by asymmetrical vertical ground reaction force and the movement arm, right? So previous study has been showed that a more anterior located center of pressure could decrease the movement arm, which is the distance between the force vector and the knee joint, but increase the distance between the vector and the hip joint. So that's why we think where the intercepts may comes from. So after this, regarding the second purpose, we found a significant decrease in knee extension kinetic asymmetries at the second assessment compared to the first assessment. We also found a more neutral shoulder and hip positions at the second assessment. So the decreased kinetic asymmetries mainly caused by the increased knee movement in the injured leg at the second assessment, which means the results, all those like supported our hypothesis, like as time goes by in squat task, patients trying to balance their movement patterns. So in conclusion, we conclude that medial-lateral hip positions correlated and predicted vertical ground reaction force and knee extension movement asymmetries during double leg squats in collegiate athletes following ACL. We think a neutral medial-lateral shoulder hip positions could reflect vertical ground reaction force asymmetries, but not the knee extension movement asymmetries. So what can we use in the real clinics? We think we could use a commercially available camera set up in the frontal plane as a low-cost and convenient tool to monitor such bilateral kinetic asymmetries. We could also use this method as a real-time feedback or training strategy to help patients to restore kinetic asymmetries, which could be virtually provided by a screen or a mirror, or maybe verbally provided by the therapist or trainers. So that's this study. I'm happy to answer any questions.
All right, well, thank you both, Ling and you, for your excellent presentations. Evan stepped away to go to his other meeting, so I'm going to be leading our question and answer session here for the group. I have a number of questions prepared, but I wanted to open it up to the floor first to see, does anyone have any specific questions for Ling, you, or both of them? And if you'd like to type things in the chat, feel free. I'm happy to ask questions if you'd rather that as well. So I will kick one off. And just to get a little information from both of you here is hopefully an easy question, but a fun one. So for many of us, publishing in the Journal of Biomechanics represents kind of like the pantheon of our field. What was your experience like submitting and publishing through this prestigious journal? And do you have any tips for other authors hoping to publish there?
For me, I think the experience is about you need to look at the guideline for the authors, because the different journals have different like guideline to let you to submit the certain journal. And when you go to that panel, you may see you maybe submit like in a certain citation style or maybe different font or kind of like that. So the experience for me is like you need to read, go through the guideline carefully, since kind of like a lot of things you need to take care. Yeah, that's it. Most of the thing I think is complicated for me.
Absolutely.
Yep. So thanks for asking. I think the publication is huge for graduate students, I think. So yeah, I like Journal of Biomechanics, not only because it's about like biomechanics. I really like their flexibility, because some journals I don't like, because there are lots of requirements when you submit it, and they want to do lots of survey or something. Yeah, I mean, it's okay, but just not like as easy as this one. And they're good at like focus on your interests and the idea of it. So yeah, I guess that's like both Ling and I, our publications is from the Journal of Biomechanics, the same as another one, like the exoskeleton we did in our lab. So yeah, I think that this is a good journal, like it's pretty closely aligned with our like area, like sports biomechanics, and just to focus on what you're interested in, and it's good to have a specific idea you're trying to talk about, I think.
For sure.
Also, yeah, let me think about that. For the first things, maybe you are looking for a journal to want to publish article. Maybe the first thing is also you want to know the article's interest in area. So for example, some articles maybe not publish the reviewed articles. If you are writing a review articles, maybe that is not good. That is not journal for you to publish the article. So the first is maybe you need to look at their interested in the area. Yeah. Just want make sure your article is fit that area.
Yeah, absolutely. Fit is super important when it comes to publishing. Now a bit more technical question for both of you. And it looks like that in your studies, you both chose to filter your kinematic and ground reaction force data at 15 Hertz for your inverse dynamics approach. What decisions and process went into you deciding on your 15 Hertz cutoff frequency?
I think that's a good question as well. Basically, what I'm doing here, I just based on previous studies. I believe we all, as long as there is a citation, I think it works. But yeah, we use it quite common when we're doing jump landing. But if we're going to do some like gate circle, like this type of study, I think we use like 13 or 7. I forgot the specific number, but it will change based on the task differences we did. And also, I think, yeah, that's pretty much the biggest concern we have here. I think Danny, if he's good at it, I think his research is about in that, because I read a paper I think he published last year, or a presentation he did is about in the frequency analysis, which is great.
Mm-hmm. Yeah, and I ask as much for my own selfish, just to hear your approach to it, because I think we all know there's just a limitation, right? And we choose these cutoff frequencies based on other publications, and we hope we're not aliasing any of the signal that we're interested in, but still not including too much extra noise. So I agree that there's just not much out there to guide the specific frequency outside of a few early studies, and even then it was kind of, we're going to throw something at the wall and see what sticks. I know that there are, a few options people will use, like Fourier transformations and wavelet transformations, to try and help identify those frequency bands as well. But similarly, I've seen a lot of 15 or 10 or higher frequency cutoffs for studies looking at things like jump landing. So it's great.
Mm-hmm.
All right, I've got a few more questions here, and actually plenty more. So we'll keep it going. So this question is for you. The kinematic and kinetic variables in your study were extracted at the lowest position of the squat, and you mentioned your reasoning was because the extension moments and moment asymmetries are shown to be greatest in those positions.
Yes.
Clinically, a lot of our non-contact ACL injuries occur in shallower degrees of knee flexion, as you kind of showed as were showed in the videos. 20 to 30 degrees of bending. Did you or your group consider evaluating the kinematics and kinetics at those angles, separate from the full depth squat?
I think that's a great question. I think it's to answer this one, because we have another study we just finished writing is in review, is talking about the jump landing task. It's also after the ACL reconstruction. So for that one, we analyzed the average between like the descending phase and the ascending phase, because I think to clarify the phase is important, and also the event is important, is we could give a specific instruction in the real clinics. Like, for example, I believe Aaron, you have like lots of experience of that, like during the practitioners. In practical application, we could just, you want to focus on the lowest hip lowest squat position. That could be like specific, but since like jump landing, it happens so fast and the time sometimes important. So we will see you want to monitor the whole face. So that's why we did a different. I mean, that's a reason we did different things. Besides for the yes, knee extension is important in ACL injury, but after the injury, I think the secondary injury there could be slightly different compared to the primary ACL injury. So we think squat is relatively slow and balanced. I'm not sure like how much important to find a specific like knee flexion angle in this case. But I think it's too important to find a specific like event. You're trying to find, for example, the knee extension movement at the lowest knee flexion angle in jump landing. I think that could maybe due to the different tasks. That's a different. That's my concern. I hope I answered your questions.
No, absolutely, and it ties into a question that I can ask to Ling. And so we briefly discussed this before everything started today, but I really liked your rationale for deciding the time points at which to extract your kinematic and kinetic variables in the first 100 milliseconds after the actual landing. Could you talk about why you made that decision and why it might be superior than, say, simply picking out the maximum and minimum that you get from those same variables?
Yes, since based on the epidemiology study and also the previous study from our Dr. Dai, because they found that the ACL injuries happen very quickly. That is not because not correct landing when people touch the ground, they just get the incorrect reaction, so they got injured. Actually, that is because they didn't prepare it very well. So that's the ACL injuries happen very quickly within the 157 milliseconds. That is lots of the epidemiology studies showed us that's the time. And also, like I said, the previous study, when Dr. Dai to examination of the javelin this scale, and they found a real ACL injuries happened around that, the taxing process, and they found that ACL injuries happened actually around 55 milliseconds. So we think that is kind of like the windows for the ACL injuries happen. So that's why we just most focus on the ACL loading variables during that period, like within the 100 milliseconds, just based on previous study and real case. We think about that's important.
Yeah, I think we can all really learn a lot from both of your decisions on how you extracted those variables. And it seems super important, for me coming from a clinical perspective, moving into the biomechanics research space, that we pay attention to the event itself, especially if we're trying to talk about mechanisms and or prevention. And so, when we're thinking about designing our own experiments, looking at that task very specifically, going back through that epidemiology literature can be super helpful and informative on how we end up conducting a more ecologically valid experiment. So a similar question for you, Ling. Near the very end of your discussion, you wrote a great sentence and you mentioned that following demonstrated knee biomechanics associated with the least ACL loading because of removal of the constraint of center of mass in both the vertical and horizontal direction and involvement of your other body segments to dissipate force. So do you think that some of the non-contact ACL injuries that we observe are because the athlete is constrained in one or more of those directions, that they don't have the option to, I guess, move into a position where they're not going to run into somebody else or something?
So could you clarify your question? Sorry, I just can't catch you on the last. Yeah.
No problem. So do you think that some of the ACL injuries that we observe occurring are due because athletes are constrained in either the vertical or horizontal directions, meaning that when they go to cut or go to land, they're not able to fall or continue their momentum into those directions because they're trying to avoid something or someone?
Yeah, exactly. Since during the competition, it has the time constraints, and also during in that intense, most of the time the athletes not focused on the jumping landing itself, right? They maybe focus on other things, maybe the ball, maybe the opponents, or maybe their teammates. So for this situation, kind of like the attention distract, and also they have another things for example, the dual task. Then maybe after landing, they needed to perform another study, like after landing, they need to do the cutting and later on. So a lot of things, I think, constraints they need to perform the landing softly. And of course, it's related to the negative cognitive loadings, and also maybe the muscle strength, something like that.
Yeah, awesome. I think I saw a question from the crowd here. Feel free to chime in.
Hi, Ling and Yu. Nice to meet you. My name is Jackie. I'm a second-year PhD student at University of Southern California, and I'm currently working with Dr. Susan Sigward. I kind of came in a little bit late, but I listened to your conclusion part, and I am really interested in the real-time feedback. So I am wondering if you have an idea of the specific feedback you want to offer to the subjects. For example, if you were to give them verbal feedback, how would you instruct them to, like, let's say, target on the use of hip or the knee? And in terms of the visual feedback, are you going to use some specific technology, like you just put qualities or what, any kind of mocap real-time capture on the screen to them? So I kind of want to know more detail about the plan.
I'm not sure how about the effectiveness of this visual or maybe or verb instruction, but the one thing I'm really sure that just based on the verb instruction, you can just instruct the athletes to do more soft landing. So like this studies, actually the participant coming here, maybe they don't know what the soft landing means, right? But when we just instruct them to, maybe you need to bend more your knee and bend more your hip during the landing, and that is the soft landing. So we just provide them the verb instruction, but after after this data process, we can find that actually they did that, like the soft landing more, like they can reduce the ACL loading or knee loading parts. So I think the verb instruction is helpful. And also based on the motor learning class, we know that if the people look at the screen, there's videos instruction that will be helping more for the people to learn some behavior. So I think maybe the screen, like the video instruction works as well.
Yeah, cool. So thanks for asking. I think it's a great question because we really want to do something for the real-time feedback, right? And I think recently I just read a paper, and I think they did it so smart. They found 6 points, which is bilateral like shoulders, bilateral hips, and bilateral ankles. So they developed a specific software when they're doing jump landing, and I think when they're doing squat. So during that case, if you always maintain your body as a triangle shape, that means you keep straight. If, when you twist it or you move, the shape not gonna be the same triangle as what you're supposed to do. That's a real-time feedback they provided. I think for us, it's good to develop a software or a technique to do it. But if we cannot do that, I think pretty much we could maybe draw some dots on a mirror. It could be a virtually, obviously feedback. And also for the verbal feedback, we usually, what I'm going to suggest is trying to maintain your hip. And also, I know it's kind of hard if you don't have experience about what the instruction talking about. I pretty much just show them what it gonna looks like if you medial-lateral shift your hip and what it's supposed to be. So I think if you have my email, and I'm happy to share my email, I could share that article to you after today's class, today's presentation. So yeah, I think they did it pretty smart. And also they did it as a training. They trained with squat, and after that they did a pre-test jump landing and a post-test test jump landing, and they found a significant improved based on that strategy. So I think it could be a good thinking about motor control and the dynamic system. So I hope I answered that. And besides, I love your profile. It's cute.
Thank you. And that was really helpful. Thank you.
Yep.
That's a great question, Jackie. And I think they did a wonderful job answering the pretty complex question and something we've been trying to answer in the rehabilitation side of things for a long time. So you going back to your paper, you mentioned in particular, you acknowledged it in your presentation that the frontal plane hip position, affected the vertical ground reaction force asymmetries, but the knee moment asymmetries weren't quite as closely linked. And that's because, as you pointed out, there are multiple planes going on or at play here. So I'm going to ask you on the spot a difficult question. Do you think that the frontal plane kinematics or the sagittal plane kinematics have more to do with the either ACL injury and its initiation or secondary injury risk?
I think that's a great question because I did think about it. Because after I think we monitored as a time sequence. So the first assessment I will see in the frontal plane, the bilateral is important, but it looks like how important it is getting decreased as time goes by. Because I think it could be mainly because of the physical therapies they will get you to do task balanced. So after that, they're trying to redistribute how much they use in different joints. So most of study in a long term, like maybe around 2 years after ACLR, more like asymmetries or more contribution happened in different joints, such as I think so far they found that patients use their hip and ankle more in the injured leg around 2 years. And in that case, they already achieved the balanced vertical ground reaction force in the bilateral direction and maybe closely to balance the knee extension movements around 2 years. But I mean, still have close. I think as time goes by, the importance of sagittal plane getting greater and greater.
For sure. And then you mentioned that you recommend individualized assessments for kinetics that might be separate than the squat, for example. Do you have any thoughts or what you might think is the ideal way to assess the kinetic contributions for someone individually?
I will see you want to focus on the hip and the ankle where you stand it. Like when you're doing squat, you don't want to move in your hip or your trunk laterally. That's gonna be what I think, because you could move in your hip but keep your shoulder in a neutral position. That's what I think, if I understand your question correctly.
Yeah, and it's kind of getting at the larger question of, we have a lot of research on ACLs, but yet we still see up to almost 1/3 of people potentially go on to a second injury. And so we've been searching for this holy grail of assessments on how do we determine when someone's ready to make this jump. And as you kind of both alluded to in your papers, time is often a criteria, and we can't just rely on time. And so we've been searching for what we can do other than looking at how somebody moves, because we know quality is important, like you said, evaluating frontal plane kinematics or sagittal plane, but finding an additional battery of tests. And so commonly we'll also use isokinetic testing of like quadriceps force production to try and give another piece of the picture that maybe your quad might handle that sagittal plane moment a little bit differently during jump landing tasks, as well as cutting and things that are a bit more dynamic.
Yeah, exactly. Because our lab also did another long time studies with NCAA athletes. We found the baseline and we tested the baseline before injury and also monitored the time sequence after injury. So far the threshold we use the bilateral asymmetries as 10%. That's a suggestion. We will give specific if you have knee extension movement asymmetries around above 10%. We don't think that's good for safely play. Besides, I do think more and more people talking about the psychology part, because as you mentioned early, lots of athletes, they feel fear of re-injuries. That's definitely a cause of playing and back to pre-injury levels. So I hope I know more about psychology influence in that case. So yeah, I think that's cool. That's a good yeah, that's a good thing in future.
Absolutely. No, thanks. And I have one last question for Ling. First, a comment. I love figure 1 from your paper. The fact that you got that person falling down on the mat is awesome. That's published in a journal. I thought that was hilarious. But kind of related to this idea of falling as a potential prevention strategy. I know it's my job as a physical therapist to come up with these things, but I'm always curious to pick your brain as a researcher. What do you think that might look like in terms of teaching practical and safe falling techniques, in a sports environment, other than, where we have a gymnastics pad to jump onto?
Yes, actually, before the COVID, when I got my master's degree, actually we planned to train people how to fall on the ground instead of the mat, to like apply this to real world, kind of like my research. But just because of COVID, we stopped this plan because, when we train the people, we need it close to them. So maybe that is not a good time to perform that. But we did plan that because we also come up with how to train the people. So first time, maybe we just ask the people to stand straight and try to lift one leg and try to lean their body to fall on the mat, because the first time maybe people afraid of falling down on the real surface, the harder surface. So maybe the first step, just letting them to experience how to fall on the ground. And then later on, the second step, maybe just let them to like 2 step back, try to jump forward a little bit and try to rolling on the mat as well. And just teach them like roll on the shoulder, hand, and the hip, kind of like in order to rotate their body. So kind of like step by step, we train the people can finish this process in 1 week. So that is our plan, to train the people to finish this whole process, just like to step by step to teach them. And finally, they can like stand on a 30 centimeter high box and try to have forward velocities and to try to roll on the ground. But yeah, that's just a plan. So we haven't performed it yet.
Yeah, it's such a fascinating idea and strategy. I haven't even thought about, because obviously those people that, like Steph Curry's video that goes to the ground, he's not getting injured, he's popping right back up. And
yeah,
if he
so
had tried to land,
yeah, we need a progressive and safe training for the people. Actually, we just did the pilot study, like you and I did this pilot study. We train this every day and just use 7 days to finish this whole process. So you talk about your feeling when you're in that program?
The markers hurt me.
Yeah, but finally, after 1 week, you can roll on the hard surface. But yeah, it's pain a little bit because markers is on the hip and the shoulder part is really hard. But yeah, I think just 1 week we can just perform this training for just normal people, not exactly athletes. If we apply it to the athletes, I think we can handle this very well.
It's super cool and just kind of a novel idea. It's something that's used in geriatric rehabilitation to teach older individuals how to fall safely, to avoid, things like arm fractures and hip fractures. And it makes total sense that this could be potentially implemented into sports where there's high risk injuries occurring as well. So I'm going to open it up to any other questions here on the floor. Otherwise, I'm going to at least stop the recording if anyone would like to ask something off of the recorded session. Anything anyone wants included before I stop? All right, I'm going to stop our recording.